guys, Dr.Anatomy here. So in this video we are going to discuss about spinal cord. We had already discussed about the spinal cord's anatomy and all. Now we are going to discuss about its tracts and nerves. Okay, and these are our ascending tract, for example, descending tract. There are two types of tracts. What does ascending tracts? Ascending tracts are nothing but sensory tracts. Or sensory. Most of the ascending tracts are sensory because this takes the information, sensory takes the information to the brain. So what are those tracts? Lateral spinothalamic tract, ventral spinothalamic tract, fasciculus gracilis, fasciculus cuneatus, dorsal spinocerebellar tract, ventral spinocerebellar tract, cerebellar tract. Rest of the olivary tracts and tecto tracts are there. So those we are going to, these tracts are the important. We are going to discuss these tracts. So lateral spinothalamic and anterior spinothalamic tract. These both carries extroreceptors, as I had explained you before. So these are extroreceptors, temperature and pain, touch and pressure. These are from external environment stimulus. Okay. So lateral spinothalamic and anterior spinothalamic tract. So lateral spinothalamic tract carries pain and temperature. Okay. Anterior spinothalamic tract carries touch and pressure. Crude touch, itch. These are the sensations that anterior spinothalamic tract carries. Okay. So coming to tracts. So from the first motor neuron, sensations from first motor neuron sensation goes into the posterior horn of the spinal cord. Okay. In the posterior horn of the spinal cord, from the posterior horn of the spinal cord, it synapses with the second motor neuron. From there, from the central canal, it enters into the anterior spinothalamic tract. From the anterior spinothalamic tract, it ascends up from the medulla oblongata, midbrain, pons into the thalamus. Okay. So this is your medulla oblongata, pons, midbrain, thalamus. Okay. So this is your first order neuron, second order neuron in the spinal cord. It crosses and it goes into the thalamus. From here, from thalamus, it ascends upwards to the cortical area of the brain. Okay. It ascends upwards. Lateral spinothalamic tract, the same way, it enters into the posterior horn of the gray matter of the spinal cord. So from there it synapses with the second order neuron and it goes into the lateral spinothalamic tract, and from there it ascends upwards to the it ascends upward, okay, midbrain, pons, medulla, okay, from medulla oblongata, pons, midbrain into the thalamus, okay. From posterior ventral nucleus of the thalamus, it ascends up to the cortical area, okay. So here is your first order neuron. This is your first order neuron, okay. This will be your second order neuron. This is your third order neuron, okay. So the next, here we are having cross section of the spinal cord. From here we will know the tracts, which tracts where it is present. So this is your fasciculus gracilis. This is your fasciculus cuneatus, okay. Anterior spinothalamic tract. This is your lateral spinothalamic tract. This is your dorsal spinocerebellar tract. This is your ventral spinocerebellar tract, okay. These are all our ascending tracts we have discussed, okay. So the next we are going to discuss about fasciculus gracilis and fasciculus gracilis and fasciculus cuneatus. These are present in dorsal column of the spinal cord. So these ascends, okay. So what are this fasciculus gracilis and fasciculus cuneatus, okay. It uh fasciculus gracilis and fasciculus cuneatus takes proprioceptive sensations. As we had discussed before, proprioceptive sensations are nothing but deep touch, pressure, tactile sensations, and stereognosis. Okay, deep touch, pressure, tactile sensation, and stereognosis. So the tracts will start. First order neurons will start from here, from the spinal cord. It goes into the first order neurons, taking this deep touch, pressure, and tactile sensations. It goes into the dorsal white column of the spinal cord and it ascends upwards to the medulla oblongata and it enters into the nucleus cuneatus. Okay, it enters into the nucleus cuneatus. From here, second order neurons crosses in the medulla oblongata and it ascends upwards from the crosses and it ascends upwards. Okay, it crosses here and it ascends upwards. Okay, crosses here and it ascends upwards to the posteroventral nucleus of the thalamus as a second order neuron. This is your second order neuron. Okay, second order neuron. From here, it ascends upwards to the sensory cortex. Okay. The same way, from the lower limb, these it takes the information, goes into the nu- nucleus gracilis from the lower limb. Okay. Here it crosses in the middle of longeta and it ascends upwards. It ascends upwards, pons, midbrain, and inside it goes into the thalamus, postoventral nucleus of the thalamus. This is your second order neuron. The third order neuron from thalamus, it enters into the sensory cortex. Enters into the sensory cortex. Okay. To the sensory cortex. So here is the first order neuron from middle oblongata. It's our second order neuron. From the thalamus, it goes into the sensory cortex in the third order neuron. This is your third order neuron, and okay, this is your third order neuron. So thalamus midbrain. Okay. So proprioceptive sensation, it takes nothing but deep touch, pressure, tactile sensation, or stereognosis. So the next tract we are going to discuss about here is dorsal and ventral spinocerebellar tracts. Dorsal. Okay. First we are going to discuss about dorsal spinocerebellar tract. Then nothing but the first order, it takes the sensation conscious, unconscious muscles and joint sensations. The tract starts from the spinal cord. It enters into the posterior horn of the gray matter of the spinal cord and it goes into the dorsal. From second order neuron, it goes into the dorsal spinocerebellar tract in the lateral horn of the white column of the spinal cord, and it ascends into the medulla oblongata and it enters into the inferior cerebellar peduncle. This is nothing but there are three peduncles: superior cerebellar peduncle, superior cerebellar peduncle, peduncle, middle cerebellar peduncle. This is nothing but inferior cerebellar peduncle. This, okay, it enters it through the inferior cerebellar peduncle. This is the important point you are going to remember in this tract. Okay, next we are going to discuss about the ventral spinocerebellar tract. The first order neuron enters into the posterior horn of the gray matter of the spinal cord and it crosses from the central canal and it ascends to the ventral spinocerebellar tract of the lateral horn of the white column of the spinal cord and it enters into the medulla. Okay, and it enters into the medulla and it ascends to the medulla pons mid. Okay, it ascends to the medulla pons midbrain. Okay, and it goes through the superior cerebellar peduncle. As I had discussed, there are three peduncles. Okay, this is your superior cerebellar peduncle. Okay.